Today we are going to see about some images in hematology, particularly in RBC chapter. Before that, we should know something about hematopoiesis. First, pluripotent stem cells, which give rise to myeloid and lymphoid series. From myeloid series, proerythroblast, monoblast, megakaryoblast, and myeloblast. First, proerythroblast, which is larger in size, and 80% of the cell occupied with the nucleus, and there is scant cytoplasm. From proerythroblast, it gives rise to basophilic erythroblast, then polychromatophilic erythroblast. Hemoglobin starts to appear in this stage. After that, orthochromatic erythroblast, then reticulocyte. So reticulocyte is the first non-nucleated cell in this series, and but it has some nuclear remnant with it. Okay. After that, erythrocyte, which is mature RBCs. From above down, cells become smaller in size and they starts to lose nucleus. Then the shape of the RBCs. RBCs are biconcave in shape in circulation, but in slide it is spherical in shape. It has central pallor in it. It is 7.2 micron in diameter. Next, reticulocytes. Reticulocytes are larger than RBCs, and it has some bluish tinge in it. So why this? What is the reason for this bluish tinge? It is actually a RNA material. So from bone marrow, these reticulocytes goes to spleen. In spleen, splenic macrophages clear this RNA material, that is nuclear remnants, and after that the mature erythrocytes are developed, which will go into circulation. So normal reticulocyte count is about 0.5 to 2%. Reticulocytosis is which is the increase in reticulocyte count for more than 2%. So reticulocytosis is seen in hemolytic anemia, blood loss, and post-splenectomy. So these reticulocytes are best seen in supravital stains. These stains shows the RNA reticulum. Next, microcytes. Microcytes are smaller than RBCs, that is less than 6 micron meter, and it is seen in iron deficiency anemia and thalassemia. Macroovulocytes. These are RBCs which is oval in shape. It doesn't have central pallor or decrease in amount, which is seen in megaloblastic anemia. Megaloblastic anemia is due to deficiency of either B12 or folic acid. Next, Anisopoikilocytosis. Aniso means ISS, so size. Poikilo means shape, so variation in size and shape of RBCs. It is seen in iron deficiency anemia and in severe anemia. Leptocytes. Leptocytes are oval in shape, and it is very pale. Only thin rim of hemoglobin is present. Next, pencil cells. Pencil cells are seen in iron deficiency anemia. In iron deficiency anemia, there is Anisopoikilocytosis. That is, the different size and shape of cells are seen. One example is these pencil cells, and tear cells also seen. Dacrocytes are teardrop cells. Dacro means tear. What is dacrocystitis? It is inflammation of lacrymal sac. So dacro means tear. So how this teardrop cells form? It is a RBC in bone marrow infiltration and also in splenic infiltration. RBCs get squeezed through it, so it gets this shape. It is seen in myelofibrosis, marrow infiltration, and in functional asplenic condition like iron deficiency anemia, thalassemia, and hemolytic anemia. Next, these are sickle cells. Sickle cells are seen in sickle cell anemia. So spherocytes, it is smaller RBCs which doesn't have the central pallor. See, these RBCs are very small, and it's spherical in shape. It is seen in hereditary spherocytosis and autoimmune hemolytic anemia. Hereditary spherocytosis, it's mainly due to defect in ankyrin, and also seen in spectrin and band 3.1 defect. These are horizontally oval cells. So these cells are elliptocytes. It is seen in hereditary electrocytosis. It is mainly due to defect in the spectrum. Stomatocytes. Stoma means mouth. There is slit-like central palar is seen in stomatocytes. These stomatocytes are seen in hereditary stomatocytosis and in case of liver disease in LK deficiency. These are target cells. So it's seen in thalassemia, sickle cell anemia, liver disease, post-splenectomy and in hemolytic anemia. Acanthocytes are spur cells. So see, these cells have a different length and different shape of projections in it. So these acanthocytes, when it goes to spleen, it gets a spherical shape and it has some projection on it. These are called spheroacanthocytes. These acanthocytes are seen in A-beta lipoproteinemia. Next, echinocytes are burst cells. See these cells. These RBCs have smaller projection, have the smaller projection, and each projections are at equal distance. So it is seen in uremia and echino, E for EDTA artifact, and chyne, that is pyruvate kinase deficiency. These cells are golf ball inclusions or HPH inclusions. It is seen in alpha thalassemia. It is due to accumulation of beta chains. Heinz bodies. How it is formed? So normally free radicals scavenged with the help of G6PD enzyme and NEETPG. When there is deficiency of G6PD enzyme and NADPH, these free radicals gets accumulated. It denatures the hemoglobin. These denaturated hemoglobin accumulated and it's attached to the RBC cell membrane. It forms the Heinz bodies. When these Heinz bodies passed through the spleen, splenic macrophages take some bite from these Heinz bodies. After that, the RBCs which come from the spleen are called as bite cells. Bite cells have a pair of speckles and it is seen in G6PD deficiency. Cystocytes are fragmented cells or helmet cells. These cells are seen in microangiopathic hemolytic anemia. In microangiopathic hemolytic anemia, there is thrombus within the blood vessels. When RBCs passes through these thrombus, it gets squeezed and it gets fragmented. These cells are called cystocytes. Giant proerythroblast or Doppler cytoplasm. I already told about that proerythroblast. When this proerythroblast have some projection on it, these are called giant proerythroblast. It is seen in pure red cell aplasia, which is due to parvo B19 virus infection. Basophilic stippling. These are RBCs with some bluish material in it. It is actually a precipitated ribosomes. So it is seen in lead poisoning and sideroblastic anemia, megaloblastic anemia and hemolytic anemia. Howell Jolly bodies. These are basophilic nuclear remnant in RBCs. It is seen in megaloblastic anemia, hemolytic anemia and post-splenectomy. Cabot ring. These are remnant of nuclear membrane. Howell Jolly body means remnant of nuclear remnant. But in Cabot ring, it is a remnant of nuclear membrane. It is seen in megaloblastic anemia. Ringed sideroblast. Sidero means iron, blast means precursor cells. So, it is accumulation of iron in RBC precursor in ring-like fashion. It is called ringed sideroblast. Criteria to call it as ringed sideroblast is the iron should cover more than 1/3 of nucleus, or it should be more than 5 granules. So these ions are better seen by pure Prussian blue stain. Iron gets absorbed from the small intestine. It goes to bone marrow for heat synthesis. In bone marrow, it goes to erythroid precursors. In erythroid precursor, 80% of iron goes to mitochondria for heme synthesis. Remaining 20% iron stored as ferritin. In mitochondria, iron gets incorporated with photoporphyrin to form heme with the help of vitamin B6 and some other enzymes. If there is a defect in photoporphyrin formation, or if there is a problem in iron incorporation with photoporphyrin, this leads to sideroblastic anemia. It is seen in B6 deficiency and anti-TB drugs. Example, isoniazid. It itself leads to B6 deficiency, and in alcoholics and in copper deficiencies. If there is iron granules in RBCs, these are called as Pappenheimer bodies. Sideroblast means iron accumulation in RBC's precursor cells. So these Pappenheimer bodies are also seen in sideroblastic anemia and in post-splenectomy. Next, parasites in RBCs. So if it is ring form seen in RBCs, it is due to Plasmodium falciparum, and if it is Maltese cross appearance, it is due to babesiosis. This is all about RBCs. Thank you.